So to generate those kind of solutions, like I mentioned, for the Lancet Commission on Stroke, the World Stroke Organization Lancet Commission on Stroke, what we did was that we had commissioners from more than 300 commissioners from more than 84 countries that participated in development of the stroke ecosystem and implementation. For the Lancet Commission on Neurorehabilitation, we're going to do pretty much the same. We're working with many organizations: World Federation for Neurorehabilitation, World Federation for Neurology, World Stroke Organization, and so on and so forth. Okay, of course, with World Health Organization, with the IHME, Institute of Health Metrics in Washington, that's the GBD group. So we're going to work with different people, policymakers, implementation partners, ministries of health and all of that, to co-create the interventions and how they can be disseminated and implemented. Now, some of the things that may help where there is a huge gap in personnel are things like task shifting, task sharing, tele-neurorehabilitation, but we have to really put these to test and determine at what point they will be safe to apply. But one thing that is very clear, and for which there is clear evidence, is that multidisciplinary intervention is effective, and also education of the patient, the caregiver, are also very effective. But for the other things, we need to generate evidence and see how we can improve implementation across the globe, and then train a critical mass of personnel, neurologists, psychotherapists, speech and language therapists, physiotherapists, and all that can deliver this care. And then, of course, another thing we're going to do is to model our intervention. Working with the GBD, we want to project the burden and also model the impact of our intervention in reducing the body of DALYs that accrue from stroke and other neurological disorders across the globe. And we will come up with an economic case. Our interventions will be costed. We also cost the economic cost. We assess the economic cost of stroke and of other neurological conditions. So we know the direct and indirect costs. Then we look at our interventions, major interventions, the direct cost and indirect cost of those interventions, and use that to make an economic case. We will also assess the cost of not intervening. Like some people will say, if you think education is expensive, try ignorance. And you see that ignorance is even more expensive. So we look at models, and this is going to help us to engage with policymakers at a very high level, and even also with the population at the grassroots level, through social media, through different kind of media, and then policymakers through different fora, World Health Summit, World Health Assembly, United Nations General Assembly, and so on and so forth, to ensure that we are able to leverage existing and ongoing WHO activities like the WHO Intersectoral Global Action Plan against epilepsy and other neurological disorders, and many other initiatives of the WHO and many sister organizations, World Stroke Organization, World Federation for Neurorehabilitation, and so on, to ensure that the solutions, the pragmatic solutions that we co-create, gets implemented, gets evaluated, and have real impact on the ground.